Hi, I'm Matthew Noble, one of the shoulder specialists at Crystal Clinic Orthopedic Center. In Chapter 2, we're going to go over basic exercises that you're going to be doing during your rehabilitation period shortly after surgery. The first thing I want to do is these are going to be good to reduce our swelling, reduce our pain, and make sure that we're not getting stiff in other joints like our elbow, wrist, and hand, okay? So the first one that I'm going to have her show you is we're going to do elbow flexion and extension to loosen up that elbow. So she'll come out of her sling just as we showed you in that Chapter 1 video, and we can do active flexion and extension of that elbow. So you see her keeping her elbow at her side and she's just straightening and then flexing that elbow up, okay? Now in certain cases, like a biceps tenodesis, it'll be written in my protocol and you'll know exactly those. We'll have it do passively. So in those cases, your good arm is gonna bend the elbow for you and straighten it out. Again, so after you're done with doing your flexion extension exercise of your elbow, then we move on to working on our wrist. So she's going to move her operative arm up onto the table, again, using her non-operative arm to put it up there, and you're just going to see her bend her wrist up and down. And again, we're reducing that swelling that you're going to see in your hand, which is pretty common after surgery. After you've loosened up your wrist, you're going to do some hand exercises. So she's going to open up her hand, close to make a fist, open up her hand, getting all those joints working in the hand because you are going to have quite a bit of swelling. This is a good time to talk about the fact that after surgery, I don't want you wearing any rings or jewelry because your fingers are going to swell. You can also do these with a ball. As your swelling goes down, this helps kind of squeeze those vessels and move that fluid out of your hand, okay? Other things that people notice after surgery is their neck gets stiff just from having their sling on all the time. So I'm going to have you move your head up and down, just getting nice motion in your neck. You can also work on rotation, so just turning your head one side to the other side, making sure that we're not getting stiff. And we can also bend it to the side and back. Doing these after surgery are important every day because, again, it's going to keep you from getting stiff. It's going to help us during this long process, okay? One of the more advanced exercises that I want you doing in this stage of your rehabilitation process is doing some scapular squeezes, keeping mobility in our back and also strengthening some of those muscles. The most important part of this, though, is, again, our operative arm, I don't want you using it, so I want it nice and relaxed. She's bracing her hand up against so that it's not hanging. And what she's going to do is she's going to try to pinch her shoulder blades together and then relax and pinch them together. And she's going to keep doing this while I talk, but what you notice is she's not moving that arm. This is all coming from her trying to bring those shoulder blades back. I'm going to have her turn now too, so you can kind of see. So she's going to pinch those shoulder blades together, and you can kind of see a crease here. She's trying to, so I try to tell people, imagine that you're trying to squeeze something between those shoulder blades. Again, don't over accentuate. I don't want you pushing that shoulder back. This is all coming from your back muscles, okay?